Hello, my name is Aubrey Demler, and today I am going to be presenting on the role of the public health nurse. Okay, so this first slide provides a general overview about the profession of a public health nurse, including some education and training that's recommended for one who would like to go into the field, as well as some responsibilities of the public health nurse, as well as various associations that are available to join as a public health nurse. So regarding education, it's required that a nurse has a RN license as well as a BSN. And in addition, the nurse must have a public health certificate. As far as recommended education to have, the nurse has the option to pursue a master's degree in nursing or a master's degree in public health to further his or her job opportunities. In addition, clinical experience is important, as it is in all nursing fields. And in particular with public health nursing, there are so many different niches that a person can go into. So it's important that a nurse is able to show some experience and proficiency in a certain niche or field within the public health field as a whole. So as far as different roles and responsibilities of the public health nurse, we've kind of focused on these throughout our semester together, but kind of just giving a general refresher and overview. The public health nurse works to monitor patients, their health, and prevent communicable diseases and kind of track them through epidemiology and things like screening and providing vaccinations. The nurse works to promote the health of her community or his population, including a special focus on vulnerable or at-risk populations. These can include maternal health, children, and adolescent health, and as well as a focus on prevention of abuse and neglect of groups such as children, elders, and spouses, and kind of focusing on safety as well. For these individuals. And then also a big part of the public health nurse's job is to provide screening, case management for patients, and referral to various resources in the community as needed. And overall, the public health nurse applies the nursing process when working with patients and communities, including assessment, application of different interventions and programming, and then also, of course, evaluation of those interventions and programs to kind of see the effectiveness of these interventions for individuals, their families, and the greater communities. And the public health nurse has the opportunity to join various associations within the field. These include the Association of Public Health Nurses, the Rural Nurse Organization, the National Association of School Nurses, the Alliance of Nurses for Healthy Environments, the Association of Community Health Nursing Education, and Public Health Nursing Section. If pursuing a career in the field of public health nursing is something you've thought about, this slide will provide some pros and cons about the field of public nursing, good things to consider, as well as some general logistics about what the profession can offer you as a nurse. So kind of some benefits of working as a public health nurse include really just a focus on advocacy and social justice, and being able to provide a voice for those who are most vulnerable in our communities and our overall population. And so that can be a really fulfilling cause to be a part of. The public health nurse focuses on interventions and change in a community that is lasting and can affect a large sum of people. And oftentimes this change promotes something that is systemic and can really affect, like I said, a large amount of people for a great amount of time for their future and the future of generations. Also, the field of public nursing, as I had mentioned earlier, does provide a wide variety of different job opportunities. And so there are so many different niches or specialties you could kind of go into throughout your career as a public health nurse. On the flip side, some kind of things to think about that might caution some people against going into the field would include potential financial constraints and budget limits that a person could come into could be faced with when trying to connect their patients and communities to resources. Oftentimes, unfortunately, money becomes something that can be the barrier in between a person and their ability to receive like quality, adequate care. And so this is something that a public health nurse can often strive towards improving, but it can also be kind of an uphill battle too, unfortunately. So that's something to be mindful of. Also, generally, the public health nurse has a lower average salary in comparison with other nurses in other fields of nursing. And sometimes, depending on the job that you have, there might be a tendency for the public health nurse to more often work independently without kind of direct supervision of, like, let's say, like a charge nurse, in like the inpatient setting. You might have a little bit of more kind of independence and a little bit less supervision, or kind of someone to look to for immediate guidance. So that's kind of something to be mindful of, and can change from job to job within the field. There's just there's really truly such variety and variability depending on the job within the field. And then also, as a public health nurse, like I mentioned earlier, you're really an advocate working with the most vulnerable in our populations, trying to help those who are really faced with a lot of adversity, And so this can be stressful at times and offer some challenges, dealing with people who are kind of at potentially rock bottom and experiencing immense amount of distress or stress in their lives, not having access to quality care or the resources necessary to take care of their family and things like that. So that can offer some challenges when you're trying to support and help these individuals. And then also kind of switching gears here a little bit to kind of talk about what the job can offer in terms of salary. So I currently live in Bakersfield, and I found that the average base pay for a public health nurse here in this city is about $29 an hour. However, that is lower than the average base pay for nurses in a lot of other jobs outside of public health. So something to consider. But in addition to that, the U.S. Bureau of Labor Statistics does project growth within the field of public health nursing. There is an increased emphasis on illness prevention and the importance of preventative health. So we expect that this could lead to an increase in job opportunity and the need for public health nurses in the future. So that's a positive thing to consider. And then lastly, as far as the environments you can expect working in as a public health nurse, there's a bit of variety here. You can work in places such as an outpatient setting, in community clinics, government organizations, nonprofit organizations, and schools, to name a few. This slide is going to talk about the core functions of the public health nurse. So the 3 core functions include the following: the assessment of the population or community and their needs, development of policies and interventions to bridge existing gaps that keep individuals from being able to have access to optimal health care and therefore optimal well-being and overall health. And lastly, it includes assurance, which is also known as the kind of last final part of the process, which includes the evaluation of the effectiveness of the interventions and programs and policies that are put into place. There are many essential services that the public health nurse can provide. So the first being, the public health nurse works to monitor the health of her patients and of her community by assessing the health and the needs of the population she or he is working with. The next includes diagnosis and investigation, and looking into the reasons for why there is a certain illness amongst a population. Thirdly, the nurse works to inform, educate, and empower her patients. And this lends to the big role of a nurse, which includes an educator. And the nurse provides the community with tools and education that's needed in order to improve their health. The nurse is to be an advocate for his or her patients. Next, the public health nurse works to mobilize community partnerships, and this is huge. I feel like public health nursing is largely an interdisciplinary field. I mean, more than anything. I mean, that is just really key. Learning the resources available in the community is essential. If the certain organization that a nurse is working with does not meet the needs of the patient or the community, it's important to know the resources that we can refer our patients to and refer our communities to in order to be able to get the care that they need. And next, the nurse works to develop policies. This is also a unique part of the public health nurse's role, in that he or she works to learn about and develop policies to support especially the most vulnerable and at-risk communities in our greater population. So that's really, really key to the work of public health in making sure that policies are in place to protect and support those who are underserved and in most need. Next, closely related to that, the public health nurse works to enforce laws in order to continue to improve the health and well-being of the population or the community he or she is working among, and to create systemic change, allow for systemic change, and justice for those who are underserved. Next, the nurse works to link and provide care for individuals in our community to outside resources and services. The nurse works to assure that there's a competent workforce, that those who are providing services are qualified and competent to be providing services that they are. The nurse works to evaluate and monitor the effectiveness of various policies, interventions, and programming that are put into place. And lastly, system management and research is also part of the public health nurse's role and the service that he or she provides. And public health is largely a research-based field. It's driven by research, and research is just a huge component of the field. And so it's important that the nurse is involved in that and includes evidence-based practice in the interventions and programs that are created. I interviewed a public health nurse. I will call her EE. She is a registered nurse who holds a Bachelor of Science in Nursing as well as her public health certificate. And she works with an organization called California Children's Services, also known as CCS, located here in Bakersfield. And she is a case manager there. So basically, working for CCS, she works to help facilitate the management and funding for children who have complex or chronic medical conditions, and helping to provide them with the services and the medications and the resources that they need in order to manage their complex and oftentimes chronic diagnoses that they have. And she does so. She determines whether or not kids will qualify to be covered under CCS based on various policies that are written. So that's kind of part of her job, is that she reviews, she'll get a referral for a child, let's say, who has cerebral palsy and is in need of G-tube supplies and feedings. And so there are various policies that she kind of has to look into and assess to see whether or not this child would be eligible to receive funding and have those services covered by CCS. So she explained that she enjoys working for this organization, and that it's a wonderful service to the community, and that it offers assistance and benefits to kids with diagnoses that are out of their control. So I really appreciated speaking with her and learning a little bit about CCS and what it looks like to be a public health nurse as a case manager working for the organization. And here in this slide, I've included a video about how the pandemic has affected public health nursing, and I think it really speaks to the flexibility of the public health nurse and his or her mission to totally focus assessments and interventions based on the needs of the community and population at large that the nurse is serving. A lot of these nurses have totally had to shift their priorities and their focus of their work that they were doing before the pandemic to really being focused on doing what can be done from a public health standpoint to help mitigate the complications and the illness that's happening due to the pandemic. So I just thought this was interesting to include here. Okay, here are my references. That completes my presentation, and I just want to say thank you to those who were able to take the time to listen and take a look over my presentation. Thanks so much.